Health insurance registration remains a key step in improving access to healthcare for Nigerians. Under the National Health Insurance Authority, the government aims to expand coverage so more citizens can access medical services without paying high out-of-pocket costs. Currently, fewer than 20% of Nigerians are enrolled in formal healthcare insurance schemes. While the program promises benefits such as reduced treatment costs, better access to hospitals, and preventive care, challenges remain. These include low public awareness, irregular income among informal workers, and delays in registration processes. Health experts say improving digital registration and strengthening state-level schemes could help expand coverage and improve healthcare outcomes across the country.
To help us understand how health insurance registration can expand access to care and challenges Nigerians face in enrolling, we are now joined live by the Director General of the National Health Insurance Authority, Kelechi Ohiri. He oversees the national drive to broaden health coverage and strengthen the country's health insurance system. Dr. Ohiri, thank you for joining us live on Daybreak.
Thank you very much for having me today.
Yeah, this conversation comes amidst a very profound criticism that the National Health Insurance Authority has despite operating for two decades, have not been able to achieve the global mandate of universal health coverage, still lying at 5%. How do you respond to this?
Well, thank you very much for, again, the opportunity to be here today. And it's always it's always a pleasure whenever I have the opportunity to share our journey. Indeed, you're right about the National Health Insurance Scheme was put in place in about 2006. And since then, we sort of stagnated over time. And there are many reasons for this. When it first started as a scheme that was targeted at just public sector workers and the organized private sector, and it was voluntary. And so it being voluntary meant that people didn't have to buy into it. This changed in 2022 with the NHIA Act that for the first time made health insurance mandatory. Now, of course, I mean, by making it mandatory, it means that then every Nigerian resident has to have health insurance. But three things have to come in place for us to really accelerate progress. The first is the enforcement of the mandate. And we have been fortunate that in September last year, following Mr. President's directive, a service-wide circular had been issued to all MDAs, not just to comply, but also to help in enforcement of this because it requires a whole of government approach. The second thing is the level of awareness. Part of it is about information, part of it is also cultural. Health insurance and insurance in general is not something that comes naturally to most of us. And in fact, some people joke that, people who are very religiously inclined almost assume that health insurance means that you are inviting something untoward to yourself. However, awareness is increasing. And that's why when this administration came into office in 2023, there are about 16 million Nigerians enrolled in any form of insurance. Within the past 2 years, we've added an additional 5 million Nigerians. So the number right now is about 21.4 million Nigerians who have health insurance. So progress is being made in that regard. But if you look at the population of Nigeria, there are sort of three segments. There are those who are in the formalized sector of the economy. Those are the people that typically have taken advantage of health insurance in the past. There are those who can't even afford the premiums, the poor and the vulnerable. And that's why we have things like the Vulnerable Group Fund and the Basic Healthcare Provision Fund that currently enrolls about 2.7 million Nigerians. These are people that actually need help in getting access to insurance. But by far the majority are those in what you call the informal sector. And in every country in the world, it is challenging, partly because they don't earn income regularly. The level of knowledge and awareness is varied in that group. And so what the NHIA has been doing is actually exploring ways of, one, not just marketing to them, but also using brokers, but also thirdly, making payments more flexible and making it easier to enroll. Recently, up until now, we have about 38 offices in every state in the country where people had to go in to enroll. Now we have an online platform where you can actually go online and enroll and not need to come in. So we're making it more accessible to people to enroll in health insurance. And that's partly why we have had an increase in demand and in subscription to health insurance. We're not where we should be. And of course, for every country, achieving universal health coverage is a journey. And the principle
Ohiri, if you may hear me, let me come in at this point.
Sure.
All right. Thank you so much for that wonderful background that you've painted for us and giving us those insights. Now, one thing that stands out to me is that all of this requires money. Especially as you've already segmented, the various areas of the population, and it's clear that the majority can't afford. So this needs to be budgeted. It needs to be funded. Now, with the information emerging from the ministry that governs your agency saying that they've only had 36 million naira released from their capital budget for 2025, how are you funding your operations?
Well, first of all, the funding that goes to the poor is through the Basic Healthcare Provision Fund. That means 1% of consolidated revenue is targeted at the poor. About 50% of that goes through the health insurance window, and about 45% of that goes through the National Primary Healthcare Development Agency. I hope you know when we talk about financing healthcare, there is financing the supply and the production of healthcare, which the government, through the transformation of the primary healthcare centers, has tried to bring healthcare closer to the population, the poor and the vulnerable. And then through the NHIA, we work with the state health insurance schemes to enroll people. That funding came through last year, it came the year before, and it's been consistent. And that's why we have over 2.7 million people currently covered.
What is the performance on that funding? What is the performance on your budgets?
So budget performance has been good. Almost all the funds that have come through for all the quarters last year and this year. And we have
100%?
disbursed. Yes, it'll be 100%, yes. And every quarter, there's a ministerial oversight committee that meets, and this is public, so it's not something that is esoteric, it's public. There's a committee that comes in, development partners and civil society are present. The approvals are given, the monies are disbursed, and they are disbursed to the for us, we work with the state health insurance schemes. Money is disbursed to them and people are enrolled. And the folks that are enrolled are people that can identify, they all have NIN numbers because that was made a requirement under this administration. And they actually select primary healthcare centers. And so we work in tandem. On one hand, we ensure that people are covered. On the other hand, we ensure that the primary care centers that they are going to also receive funding so that they could be service ready to provide those services. Now, even beyond that, and I must mention, through the sector-wide approach of the government, we also had a strategy to crush maternal mortality. And what that means is that the Honorable Coordinating Minister...
I want to stay on, before I hand over to Dr. Constance, sure. I'm so sorry, I just want us to deal with this issue of financing so that we hand over to her and she can take the conversation forward. The statistics say that for 2024, the budget performance for the Basic Healthcare Provision Fund that you're referring to was 15%, 233.7 billion budgeted, 26.55 billion actually released, making it 15.06%. You've just said 100%. Maybe you can just help us to reconcile that.
Yes, I mean, I think my comment is factual. So every quarter in 2024 and every quarter in 2025, we had full releases of funding and we disbursed those funding to get people covered. And I think that's I think that's what's obtained in 2024 and 2025.
So let's stay on funding. Going back to that story that the ministry's budget for last year was just over 30%. And there was a presidential advisor that was with us here on this program, and he did mention that the health ministry in general receives a lot of donor funding in order to drive its operations across the country. My question is, in terms of donor funding, what does that do to our local policies and the areas that we decide to focus or emphasize on?
I think it's important to understand that under, this administration, first of all, there is a Nigerian Health Sector Renewal Investment Initiative. In terms of policy direction, the government sets policies and development partners align with the government's policy. And that's the principle of the sector-wide approach. So we have one strategy, we have clearer governance. And in fact, when you expand the conversation of governance, it's not just with donors, it's also the compact between the federal government and the state governments so that we're all rowing in the same direction. And the Nigerian Healthcare Investment Initiative is one where every development partner in Nigeria has aligned with where government is leading. Development assistance is welcome, but as we know, things are changing in the landscape with the US government making decisions around USAID and their development assistance. And what Nigeria is saying is, well, whereas we are extremely grateful for the support over the years, ultimately, it's our responsibility to provide healthcare for citizens of Nigerians, and that's why we've taken the bull by the horns.
And that's where I'm going to come in again. Now,
Sure.
with the scaling down globally of development funding to healthcare and other areas, where are you going to find the money? You know, the budget seems like there's no money. Where are you going to find this money this year in order to drive the things that need to be driven in the healthcare sector?
So when we think about sustainability, there are three things we need to look at. So there's the financial sustainability, which means that one, can we do more with the little we have? I mean, a lot has been written about the efficiency of a lot of the development funding. So it's not a one-to-one. If somebody says they are giving you 100 naira, it doesn't mean 100 naira lands in Nigeria and is spent there. So the first thing is to create those efficiencies by using national systems to actually provide some of those services. The second thing is to localize those services in Nigeria so that you're using Nigerians and basically you're getting a bigger bang for the buck that you're spending. This is not to say that we do not need to increase healthcare budgets, but it means that we have to think strategically. It's not just more money for health, but it's also more health for the money that we spend. The second thing is that the way we design programs have to change. We need to reduce parallel systems where government is doing something, some other donor comes in and does another thing, and we have duplication and waste. So that's another way that we have started taking on the fact that we need to actually be more efficient with how we roll out things. There's also something around the governance of it, right? And a lot of times people come in, parachute, create multiple governance structures, and that also costs money. Through the sector-wide approach, and what we have established under the leadership of the coordinating minister, governance is more streamlined. Also, Nigeria has taken, when you're talking about health finance, you have to look at broader fiscal reforms. With the states being empowered to take on more responsibility, service delivery, is on the concurrent list, which means that the federal government has its role, the state governments have their mandates, and the local governments also have theirs. And everybody under this sector-wide approach has to do their own part to make sure that they are fulfilling their obligations to people. But lastly, since I'm the DG of NHIA, I'll also mention here that health insurance remains a critical way to reduce out-of-pocket expenditure and for sustainability. And this is because it works in the principle of all of us coming together, pooling resources and pooling risk. That those who are paying and not using subsidize those who are not using. So it makes it more affordable. So all these strategies have to come to play for us to actually move forward in creating a sustainable health system that is ours and that can meet the needs of people.
Okay, let's review the statutory mandate of the act of the NHIA, which was NHIA, sorry, which transited from the National Insurance Scheme, Health Insurance Scheme, to National Health Insurance Authority.
Yes.
And that emphasizes the mandatory role, the mandatory service of the 2022 Act that was reformed. And now, despite the emphasis on the mandatory service, people still believe that the authority, the NHIA, is extremely bureaucratic and very inefficient, because 70% of Nigerians, according to reports, are still being forced to make out-of-pocket expenses. And also, people have called it a national civil service scheme, because many of this, your services only is perhaps more accessible to civil servants. And 90%, the informal sector of the Nigerian population accounts for 90% of the population. So how do you address this lacuna?
Well, first, I think we need to be more nuanced when we make, sweeping statements. It is true that, as I mentioned earlier on, that when the NHIS was set up, primarily it was set up for the organized private sector and for civil servants. And that has changed in 2022. We also have a change in the health insurance landscape. NHIA is not the only insurer. We have 37 or 36 plus one state health insurance schemes that are supposed to assist with ensuring that the poor and vulnerable are covered. We have several private health insurance agencies, or HMOs, and they cater to different aspects of our population. NHIA's role is dual. It's an operator of insurance, but it's also a regulator of the industry. Now, health insurance has been made mandatory because it's important from an insurance perspective for that mandate to happen, so that you actually have a risk pool that works for everybody. Now, when the insurance was made mandatory in September last year, it requires a whole of government approach. It means that first, all federal government entities must comply. So right now, all MDAs are insuring their staff through NHIA. It means that we must enforce this, which means that every arm of government that has an enforcement mandate comes together to make sure that the same way we look at taxes, we look at NSITF, look at pension compliance, health insurance compliance becomes that. And why is it important to enforce? There's something in insurance where those who are healthy are less likely to buy insurance. Those who are more likely to buy insurance are those who are sick. It creates something called adverse selection. The social health insurance works when two things happen. When those who are well but are paying into the scheme cross-subsidize those who are sick. It also means that those who have more cross-subsidize those who have less, so that their contributions are less. And those principles are currently enshrined in health insurance. The third thing is that, we need to make sure that the mandate is not enough. We need to make it more flexible. And so NHIA is working with the private sector, with fintechs, to look at how people can be more flexible in their payment, so that at the end of the year, the full premium has been paid. It is still much cheaper for you to be insured than to wait to pay out of pocket for healthcare. And that's been our message consistently. Even for the informal sector, when somebody is sick, it's not at 2 a.m. in the middle of the night that you want to go to hospital, that you should start looking for money. If you have health insurance coverage, it means you can show up and you will get care because you're covered, and what ails you is within the benefit package. And this is something that NHIA has been driving.
Dr. Ohiri, on that note, on that note, our time is fast spent. Just one sentence before you go. What is the coverage like? I mean, what if I'm paying my premium? Number one, what is the premium? And then what amount do I get covered for in the hospital? Please, we don't have time, so if you can just give me those specific figures. Premium and what the coverage is.
Well, first, thank you. Premiums vary, right? There are premiums for 24,000 naira.
On average,
there are premiums for,
on average.
In the NHIA schemes, there are premiums for 37,000. And for the states, there are premiums for 15,000.
Per year?
And what they cover varies. They cover all the basic primary care. They also cover referral care, surgeries, treatment of medical conditions and chronic conditions as well. There's a whole list of what is in the benefit package that is covered.
Okay. All right.
Okay.
I would have loved to know if that's a premium. I know the 15,000 is per month, which is
It's
still
per year.
beyond the access of
It's
many.
per year,
but I wish you well. It's per year.
It's
Fantastic.
per year, yes.
Okay, then that's very affordable. Great. Thank
All
you
the
for
premiums
clarifying
mentioned
that.
are
Dr.
annualized
Ohiri
premiums.
of
Sorry.
which is very encouraging on that price point. If you put it in that context, then that is fantastic. Thank you so much for the good work you're doing. We continue to wish you well, and we hope that all Nigerians can be brought under the safety net of health insurance. Health is wealth. From the Lagos studio, I'm Vimbai Mutiniri Ekweyong, signing out from Daybreak.
And I'm Benga Shiru. I'm saying do have a most pleasant day.
And I'm Constance Sikoku. Thanks for watching. The morning show is next. Goodbye.